Yesterday, in the wake of increasing case counts and hospitalizations, the Illinois Department of Public Health issued a new set of recommendations for how residents should act in the next 3 weeks as statewide COVID-19 hospitalizations reach, and in many regions surpass, our highest rates from the spring. Dr. Ezike will walk through these best practices in just a moment, but our goal here is this. We're asking Illinoisans, no matter where they live, to stay home as much as possible, only leaving for essential activities if you can, like work, if you can't work remotely, school if you're learning in person, getting groceries, visiting the doctor, or getting a COVID test. If you're choosing to travel for Thanksgiving, it is even more important that you take extra caution in the coming weeks. While staying apart and holding a virtual celebration is by far the safest option, if you do choose to have a small in-person Thanksgiving, the safest way to do it is to have every single person in attendance more or less quarantine or come close to it for the 2 weeks prior. So that would start today. Testing is also critical for those gathering, and it should come as no surprise given our current rates of spread that we're now seeing a soaring demand for tests across the state. Even as the third best testing state in the nation, we're now at a place where our state-run community-based testing sites are hitting capacity before the end of their normal operating hours. So over the weekend, we're increasing capacity at our most visited sites, Aurora, Arlington Heights, and Harwood Heights. We continue to build on our testing capability, but as always, we're limited by the speed at which the existing public and private lab capacity can grow and by the physical layouts of these drive-through locations. Still, we intend to remain among the best in the nation in testing. Across the state, we're seeing increases in the number of people showing up at hospitals with COVID each day in every single region. And every single region has a positivity rate in the double digits, none lower than 12.5%, and that's in Region 5, Southern Illinois. On our Wisconsin and Iowa borders, two states that are seeing positivity rates of nearly 40 and 50% respectively, Region 1 is now up to an 18.9% average positivity rate, the state's highest. Over just the last 2 weeks, we've seen statewide increases in every single measure, from cases to positivity, to hospitalizations, to ICU visits, to ventilator usage, to deaths. I want to close today by talking about a topic we've covered during a number of these updates, and that's the role of local officials in our pandemic response. Earlier this afternoon, the city of Chicago put out a stay-at-home advisory to residents starting Monday, encouraging them to avoid all trips outside their home, aside from work and school, and all private gatherings inside residences. The city also implemented a new indoor and outdoor gathering cap of 10 people, along with an enforcement mechanism as our hospital systems face down this new wave. So I want to commend the mayor's decision because it's never an easy one to make, but it's the right one. I should also note that the city of Chicago is doing better than the rest of the state right now when you compare its current hospitalization levels to those in the spring. So let this be a model for action for the rest of the state. Earlier this week, Sangamon County and the city of Springfield announced that they would reverse course and adopt IDPH mitigations. Enforcement of those mitigations will begin tomorrow, more than 2 weeks after Region 3, home to Sangamon County, reached the metrics to require them on October 29th. On that day, the region reported an 8.8% average positivity rate. Well, it's now at 16.4% today. The average number of people coming into Region 3's hospitals for COVID-19 was 11 per day back then. It's 23 per day now. That's a 109% increase. I commend the leaders in Sangamon County and Springfield for taking this step in the right direction, because simply put, there's just no time left to waste. There are other leaders in Champaign, Urbana, and Carbondale, for example, who over the course of the last few months have taken decisive action in attempting to stay ahead of the increasing community spread of the virus, and they deserve to be commended. To the elected officials who have chosen to disregard public health guidance, those who have stood up at press conferences to question the data and fuel conspiracy theories, those who have taken their absurd crusade to the courts and lost nearly every single time, those who have flat out told the businesses in their communities to ignore what their local and state public health departments and experts, some of the best in the nation, are telling them. What is it going to take to get you to be a part of the solution? Dr. Ezike and I have stood up here every day telling you the facts. We've had dozens of the nation's leading experts present and giving you the information, their epidemiological information, their modeling information. They've stood here with us to show you how bad things can get. We've given you the data here in Illinois and the best studies from across the nation and the globe. We've shown you what this looked like in the spring and how this wave is already worse than that in many regions of the state. What will it take to make this real for you? Do we have to reach a positivity rate of 50% like we're seeing in Iowa today? 50%? Are you waiting for healthcare workers to get sick to a point where you don't have enough staff in the local hospital to cover the next shift? What about if the hospitals become so overrun that you're sick and you're dying have nowhere left to turn? Because I promise you, while you fail to take responsibility in your city and your county, that day is coming closer, and it will be on you. Meanwhile, the rest of us will still do our jobs. The state will do all that it can to help hospitals surge their capacity and find additional staff. Healthcare workers will take up their posts on the front lines as they have every single day since this began. But more people will get sick, more people will struggle to breathe, and more people will die because you've failed to do your job. While good people do the right thing by wearing masks to keep each other safe, elected leaders in some communities have allowed others to infect their constituents because they're afraid of the few loud anti-maskers, or because the elected leaders themselves are anti-maskers. In too many of these communities, responsible business owners have followed public health guidelines, only to see competitors flout the rules and prolong the mitigations for everyone else. There may be a vaccine on the way in just a few months, but a lot of lives can be saved before that happens. And when this is over, there will be an accounting by your constituents of who worked to keep the public safe and who just ignored the science. This is the moment to step up and get it right. Winter is coming. Folks, I've pledged to be honest with you throughout this COVID crisis, and that won't ever change. We're running out of time, and we're running out of options. Our growth in new cases is now exponential. We are seeing current numbers and future projections worse than what we saw in the spring. We're more practiced at responding to this virus now, so we have significant stockpiles of PPE. We have overflow capacity that's already planned by our hospitals, and we have much more testing available. But that won't slow the spread of the virus. Since the stay-at-home order ended in May, we've allowed local governments to make decisions about whether they needed tougher mitigations and enforcement, and we've only imposed certain select mitigations at the state level on a regional basis. Those tools worked where people acted responsibly in local communities. But with many community leaders choosing not to listen to the doctors, we are left with not many tools left in our toolbox to fight this. The numbers don't lie. If things don't take a turn in the coming days, we will quickly reach the point when some form of a mandatory stay-at-home order is all that will be left. With every fiber of my being, I do not want us to get there. But right now, that seems like where we are heading. If you're sitting at home and wondering what you can do to help prevent this and to stop the spread, well, wear your mask when you're out and stay home if you can. And while you're home, give your county board chair or your local mayor a call. Ask them what they're doing to enforce the doctor-recommended mitigations. Ask them what they're doing to keep you and your loved ones safe.